Hello. I went to the Mayo Clinic yesterday and I talked to my hand surgeon. He's the same hand surgeon who has helped sew my fingers to my palms, to do skin grafts on the tips of my fingers where there's not enough body fat and I have super hypersensitivity. Well, one of the ones that we've already done is this one. Let me see if I can show it to you. It's this one, the one with the marker on it. Anyways, right now I have this white spot right in the middle of that marker. You can kind of see it. It's pretty white on the tip of my finger. That's actually my skin, and we didn't paint it white. The blue is just a marker. That's where the doctor wants to cut and open my finger up again. While the finger looks pretty long, there's not very much bone left there. I do have the two knuckles on it, and I am able to bend at this knuckle. After this next surgery, I won't have it anymore, and I won't be able to bend it anymore. This is a huge difference for me as part of my quality of life and my independence level. Although it doesn't seem like much, just that ability to bend that little finger the way that I do on both knuckles, it does make a huge difference in like gripping cups, picking anything up with like the grasping area of my hand. And it makes it longer, which makes it easier for me to hold things in my hand. I will probably lose quite a bit of the finger, you know, maybe down to there or there, maybe there. I'm terrified. When he told me yesterday, my instinct, I started crying. I did a deep breath, and you know, I asked him if there was any other ways, if there was any other options, if we could use any gels, if we could just cut it open and just let the skin heal, if we didn't have to remove bone. He said he would try, but that if it was too tight when he tried to sew it back up, that would cause its own problems with my finger surgeries and whatnot. Basically, this white thing right there, again, is a skin cyst of some type. I don't really understand the whole theory behind it, but it could get infected. I can't not do something about it, and I can't leave the wound open and just heal without removing bone, not just because of the tightness, but also because then my bone would be at a huge risk of infection, and he doesn't think that we could keep it safe as long as it'll take for it to heal over. And then I'll still have hypersensitivity issues at the tip because there's not enough distance between my bone and my skin, or you know, the outside layer of my skin and my bone, whatever. Causes lots of problems if there's not enough body fat between my skin and my finger stumps. I did go through auto amputation, which is rare, so that causes a whole lot of pain in the aftermath of the stump pain, as well as the phantom limb pain that can keep you up at night. I'm really upset about the finger. I already went through a surgery to try to save the limb. You know, as far as keeping my finger sewed to my hand for a month, risking not being able to open my hand again, going through multiple surgeries just to make that one thing happen. And now, because I guess a skin layer overlapped on another skin layer and got the skin all confused, I guess it's common, I have to go back in and redo a surgery and now possibly lose the bone I tried so hard to save. anytime I go through a bone surgery, it seems very, very hard on my immune system, on my health in general. It seems to be hard on the body. Very stressful, very painful. I'm afraid right now. I have like 7 surgeries that are planned in my future, and I have been unable to find caring, compassionate, and effective pain management. I'm being asked to go to these pain management clinics, and they treat everyone like a criminal. I'll talk more on that, and how it's such a nightmare for me in another video. But I just wanted to give you the update on my finger. I'm still trying to get good pain management so that I can go through these surgeries, and I don't have a choice. I have a surgery scheduled in a month at this point. They wanted me to do it sooner. I just couldn't get in any sooner. I'm hoping maybe they'll have a cancellation, but in the meantime, the surgery is a month away, and I have to be on guard to make sure that I don't get a bone infection, which could make me lose even more of my finger than this surgery is planned. So that's where I'm at. Wish me luck, and thanks for all your support. I need it, and I appreciate it. Have a good day.